The second case study that I chose was Louis Ballinger. He was admitted to the hospital for chronic bilateral lower extremity lymphedema and a non-healing wound on his left leg. I believe that weight bias is present, but I also believe that his size and his weight also contributes to his issue that he was seeing for, because severe obesity can worsen lymphatic dysfunction and is relevant and medically relevant to the case and to the causation of coming into the clinic. But I also think the bias comes in his charts where they're calling him repeatedly morbidly obese and an obese male, and treats the weight as a main explanation for his condition, when even in his childhood and in his charts, they talk about exposure to lymphatic filariasis, recurring cellulitis, arthritis, limited mobility, inflammation, and difficulty completing self-care. So all of these things are present in his chart but aren't looked at as causes or things that are hindering him from reaching weight loss, or all of those things that can help him with his condition as well. And I think those deserve an equal assessment as well, because the bias is coming in when we overshadow other possibilities and only focus on weight because it is like a blatant thing and something that can be medically relevant. But we need to look at all the factors and how to treat that rather than just the weight. And when talking to the healthcare provider, I think I would talk about changing that in his chart to the BMI and how substantial that BMI is, because it is large and we do need to look at that instead of just recurring severely obese and all of these things. I think it's labeling him by his body size instead of by the hindrance, because the BMI and what that is the thing that's causing, and yes, the obesity is the label for that, but I also think labeling him by that can shift your perspective and not focus on the other aspects of it as well that we need to address that could also lead to weight loss. And then I would also talk to the pharmacist and the physician about the naproxen, because it might worsen like the hypertension and the fluid retention that he is having. So that would also be a conversation of just making sure he's educated and focusing on that, because edema is a problem for him. While counseling Louis, I would ask him what matters most to him, because it could be healing the wound, it could be reducing leg heaviness, moving more easily, or staying more independent because he is living alone, or it could be losing weight. So we need to ask him where his priorities lie and what he's looking for. So I would then go in to ask about what would make daily life easier for you over the next couple months. Those are the questions I would ask. And then I would ask permission to discuss nutrition, things that could help with like wound healing. If that's his priority, we need to focus on protein, about lowering sodium, and about having adequate energy and constant wound care, because that's really important. So if that's his priority, that's what we'll focus on, and we'll give him options of, if he says yes, of like switching his pretzels for a lower sodium snack, or having a lower sodium in his sandwich for his options. Or we could also focus on protein intake and increasing that and adding those into his meal, and then also showing him some like lymphatic exercises that are recommended by his therapist that we can do, and just keeping track of those things. So then I would ask his confidence again and check in with him after asking the questions and getting the permission to see where he was and where that confidence did lie. And I think for my strategy for decreasing weight would be to focus on not weight. We're gonna ask him to track the wound healing, the blood pressure, his strength, his mobility, his nutrition, the adequate amount of nutrition that he is receiving, and the quality of life, and the things that are increasing and getting better, rather than just, are you losing weight? So focusing on this being the motivating factor and giving him freedom and independence, which is things that are so incredibly motivating and are so much more important than the number on the scale, because the number on the scale, yes, is hindering those things, but giving him those things back and that being our focus is proven to really continue for long-term change and help him in the long run with wound healing and with the weight loss in general.